Hello and welcome to this video on sedation consent for the patient. Just some key points to start. Make sure you bring someone responsible with you who has signed the consent form or watched the consent video. They don't have to stay for the whole appointment, but it'd be useful to have their contact details so we can get hold of them if we're running early or late. It's also preferable to meet them before we start the treatment. Make sure you aren't planning on doing anything important or that is responsible for the rest of the day. Most people will just go home and have a pleasant snooze for a few hours. Be honest on your medical form. Sometimes it's difficult with these confidential forms to fill them in if someone is watching you, especially if there's something sensitive in your medical history. Things like recreational drug use are important for us to know about, and they affect how easy it is for you to get sedated. We won't be judgmental, just let us know confidentially beforehand. And above all, try not to worry. We won't do any dentistry unless you are really relaxed and ready to start. What is conscious sedation? With conscious sedation, it is not a general anesthetic. Patients are not completely asleep, but they're just very, very relaxed, and they may occasionally nod off. Patients will be much less aware of the environment and any discomfort that's happening. We will, of course, make sure that you're thoroughly numb, but anxiety will be greatly reduced anyway. The main drug we use is midazolam, but occasionally we use fentanyl to increase the depth of sedation. For complex surgery, we sometimes use paracetamol and a steroid called dexamethasone to help with discomfort and swelling. Please let us know if you're unhappy with us using any of these drugs. Amnesia is extremely common, and towards the end of the procedure you may be slightly more aware of what is happening. Thankfully, you will still be very relaxed, and we will monitor you throughout to make sure you're comfortable. What are the risks of intravenous sedation? Nausea and vomiting are a very low risk. Bruising or tenderness of the veins or vessels in which we place the cannula, and that's a medium risk. Slower breathing and a reduced blood pressure, which is also a low risk. And there's an extreme remote possibility that complications may require transport to a hospital for treatment. The alternatives to intravenous sedation: we can use a local anesthetic only, or you can use inhalation sedation, which is a gas and air, but that requires a referral to another practitioner. Some procedures, like surgical procedures, can be done under a general anesthesia, and that's administered by an anaesthetist in a hospital. This may involve additional costs, arrangements, and lab work other than what has been required in the dental practice setting. Of course, the other option is no treatment at all. What do you do before surgery? You can eat normally, but we recommend light food. Report to the practice any recent changes in health or any onset of symptoms or sickness, especially fever or respiratory illnesses such as cold or flu-like symptoms. Take your normal prescribed medications with a sip of water unless previously instructed otherwise. Try to wear loose, comfortable clothing, preferably not white. We'd be grateful if you could remove your jewellery, and if you can have no nail varnish, that would be preferable. Obviously, make sure a responsible adult who is 18 years or older and is fit and well and mobile must accompany you and be accessible to the practice during surgery and available to drive you home. If you cannot comply with these instructions, this may result in the cancellation of your surgery and fees may be charged. Always make sure as well that you pay for your dental treatment on the day before we start sedating you. What about after surgery? So arrange for your responsible adult to come with you and drive you home and stay with you for at least 6 hours after surgery. Please do not use a taxi. Obviously, no driving until the next day. Do nothing that involves any kind of responsibility. Avoid sending texts and emails, but call the practice if you've got any questions or concerns. To sign off on the consent, you hereby consent and authorise that sedation is administered. You understand that UK Sedation will be carrying out the sedation, and the dentistry will be carried out by your usual dentist. You consent to paying for the treatment beforehand so that you're not paying whilst under the influence of sedation. You certify and acknowledge that you've read the form and that you understand the risks, alternatives, and expected results of the anaesthesia service, and that all your questions have been fully answered to your satisfaction. You understand the treatment that you're having done today, and you've had the risks explained to you and the alternative treatments you could have to your satisfaction. But you also understand that there are rare circumstances where the planned treatment may have to be altered during the procedure. For example, when placing a filling, it might be that the decay goes too deep and there is a crack in the tooth. You give your consent for remedial work to be carried out to stabilize the situation so that the situation can be discussed later. Tooth removal will not be carried out unless your prior consent is reached. Many thanks for watching the video.